In the previous video, we discussed the evidence recorded in medical literature comparing overall survival between recipients of breast conservation treatment, or BCT, and mastectomy. To summarize, there is robust data supporting superior survival, which can be paraphrased as better cure rates with BCT when compared with mastectomy. In this second chapter, we will discuss the data available in respect to recurrence rates between the two forms of surgical treatment. Please note that this video is intended for educational purposes only and is not intended as a substitute for a surgical consultation. Do visit your doctor for a full clinical assessment and treatment planning. There are two ways to view local control. In the positive sense, local control means the absence of recurrence within the treated breast. This indicates that treatment was successful in eradicating disease from the breast. If we talk about local recurrence, however, it refers to the reappearance of cancer in the previously treated breast or in the skin and subcutaneous tissue covering the chest where the breast previously was. In a sense, while we sometimes use the terms interchangeably, they are opposite in meaning. As the Milan 1 and NSABP B-06 trials were groundbreaking studies, we will repeatedly refer to them in our videos. On the issue of local control, both studies reported that women who underwent breast conservation treatment had local control that was not inferior to those who had mastectomy. In fact, it appeared, especially in the NSABP B-06 study, that women who had lumpectomy with radiation had lower local recurrence rates than women with mastectomy. From that data, it was hypothesized that radiation was a key factor in achieving good local control. Breast conservation treatment therefore comprises of the removal of the cancer followed by radiotherapy. Studies in the years after these two trials did not always report lower local recurrence with breast conservation treatment. However, with more research and refinement of both surgical and radiation treatment techniques over time, the data began to suggest that the rate of local recurrence was declining. An important part of surgery involves achieving tumor removal with a clear margin of uninvolved breast tissue all around the cancer. However, because this is defined microscopically, a clear margin can only be known with certainty after surgery is complete and the tissue sent for pathological examination. That is the reason why, occasionally, there is a need to recommend a re-excision, or another operation to remove more tissue around the space once occupied by the tumor for a clear margin. Today, we have adequate data to be confident that local control is not compromised with breast conservation. Here are the results from a more recent study on triple-negative breast cancer. Triple-negative breast cancer is considered to be a more aggressive subtype of breast cancer, which is challenging to treat. In this registry-based retrospective study, it was found that women with node-negative early breast cancer who underwent a mastectomy without radiotherapy had a significantly increased risk of loco-regional recurrence compared with those treated with BCT. Loco-regional recurrence includes cancer returning both within the treated breast as well as in the lymph nodes in the armpit. From triple-negative breast cancer, we move to hormone-positive breast cancer. This multi-center prospective study found that women who underwent breast-conserving surgery with radiotherapy had a 5-year loco-regional recurrence rate of 1.9%. The recurrence rate for mastectomy-only patients was 4.2%, while that for mastectomy with radiation was 3.4%. The researchers concluded that women with mastectomy had a higher loco-regional recurrence risk than those who underwent breast-conserving surgery with radiotherapy. Since we have significant data to show that BCT results in higher survival and better local control rates than mastectomy, BCT should be recommended as the primary modality for the surgical treatment of breast cancer, with mastectomy performed only in exceptional cases. Higher survival rates and better local control with breast conservation treatment allows a survivor to live longer. In the next video, we will discuss one aspect of how BCT can enable a patient to live more after breast cancer surgery.